you're watching Medically Speaking. Now, it's the World Sarcoma Awareness Month. Many of you may ask, sarcoma, what is it? Well, don't be alarmed. Many of us know nothing about it. By many, it's called the forgotten cancer. But it's extremely pertinent that we spread knowledge and awareness around the same. To help me do the same, I'm being joined by a panel of medical experts, top medical minds of the country, who have come together to shed some more light on sarcoma, what it is, if at all anything can be done to prevent it, the causes and the treatment. I'd like to introduce them one by one. Dr. Sameer Rastogi, Additional Professor of Cancer at AIIMS with us, Dr. Sunil Mandhania, Senior Consultant of Oncology with us, Dr. Adarsh Barwad, he is an Additional Professor at AIIMS, and also Dr. Shamim Ahmed, Additional Professor at AIIMS. All of them have joined us. Welcome, all of you. I'm going to start, first of all, with you, Dr. Shamim Ahmed. Help us understand, for the layman watching the show, what is sarcoma? Why should we even bother or worry about it?
Yes. Sarcoma is actually type of cancer. I can say that it is also the same cancer as the other cancers are. The sarcoma is actually the tumor which arises from the soft tissue. Soft tissue means the tissue, supporting tissue of the body. Supporting tissue means like some cancer are from the organ like lung, liver, brain, and extra. But this cancer will start from the supporting tissue of the body. It can
Okay, slight audio trouble, but you have given us a start.
It can be limbs. It can be the other part of the.
Okay, so there is a little network issue with your connection, but you've given us a start into the conversation. Dr. Adarsh Barwad, would you like to come in here and take it forward? Dr. Shamim, of course, was telling us what sarcoma exactly is.
Yeah, so am I audible clearly?
Yes, you're clearly audible. Please go ahead, sir.
Yeah, so as Dr. Shamim said that sarcoma are the cancers or the tumors which are arising from the connective tissue or the supporting tissue. So our body has a supporting tissue like bone and soft tissue, which basically supports the vital organ as well as our structure. So these tumors are basically arising from those tissue like connective tissue like bone, skeletal muscle, other soft tissue, smooth muscle. These all are considered to be the connective tissue, and these are the tumors which are arising from this connective tissue, and they undergo malignant transformation and grow very rapidly and gives rise to sarcoma.
Right. But, Dr. Mandhania, we've gotten to know what sarcoma is, but is it detectable? Is it extremely difficult? When should one worry and even approach an oncologist?
Good morning. So first of all, thanks for the invitation. The first is how can we detect this? Because the sarcoma are generally a tumor which presents mostly in the limbs. 40% are limb, and nearly 30 to 40% are abdomen, and 5 to 10% are neck. So that means the area which are visible, they have a symptoms. But the intra-abdominal tumors, if they present, they don't have symptoms. So what are the commonest symptoms which we get? What, as a layman, how he need to be aware about this? So if mostly they present with the mass, that is lump or maybe some tumor, and mostly they are painless. So this is one of the very important things about the sarcoma. Till the time they infiltrate the other organs or involve the periosteum or they are metastatic, they are painless, first thing. Second thing is generally with this tumor, they start rapid increase in the size. Generally low grade sarcoma or maybe benign tumor, generally they don't have a rapid increase in the size. So if there is a rapid increase size, that means we are dealing with something which is malignant. Thirdly, they have generally their symptoms might be in terms of if the child is small, then the decreased intake, weight loss, more irritability, and limping. If the patient is having sarcoma in some limbs or maybe in the pelvis, they start limping, which is not known. Sometimes there is a fullness of the abdomen, distension of the abdomen, because the abdomen is such a big cavity. The tumors are generally in the size of 10 to 20 centimeters in the abdomen, and which are generally don't produce these symptoms. So these are the common thing which we see. And the neck. In neck region, generally it is visible. You can see there is a lump which is there in the left. There is a mass in the neck, which is quite visible. And there is generally they are abnormal. No mass in the neck is always normal, except in a small children where they have multiple neck nodes because of pharyngeal infection, repeated tonsillitis, that is different thing. Otherwise, most common symptom is painless lump.
A painless lump is something which one should watch out for. Dr. Rastogi, if you could come in here, sir. The detection and diagnosis very important, easily evasive as well. So a big challenge really for the medical community as well. But what about the treatment? Are surgery, oncology the only options available?
Yeah, so sarcoma is an extremely rare tumor. If we have 100 cancers, then sarcoma constitutes only 1% of all cancers. And also it is very heterogeneous. Heterogeneous means there are many subtypes of sarcoma. So lots of times, I mean, we are in expert institute for sarcoma, but lots of time what happens, these diagnoses gets missed, or they are misdiagnosed outside something, and general surgeons or other in periphery, they are operated and the diagnosis is not made. So first, most important thing in sarcomas is pathology. And I'm sure Dr. Adarsh is here, who is a pathologist. So first, they have to classify as correct subtype of sarcoma, because some sarcomas are chemosensitive, some sarcomas are radiation sensitive, some sarcomas are cured only by surgery. So regarding correct treatment, they have to be referred to the people who are actually practicing sarcoma in their day-to-day practice, and the pathologists who are proficient in diagnosing sarcoma in their day-to-day practice.
Okay. And Dr. Shameen, since we are talking about sarcoma being a very rare type of cancer, could you give us some data, help us understand how prevalent it is in India? Out of 100, say just a person or two inflicted with sarcoma, but in India, how many would you say inflicted with sarcoma? What's the extent? Why the need for awareness today, Dr. Shameen?
Yes, as Dr. Samir already has explained about that, if we will detect 100 cancer, there will be one cancer who can be will be classified as a sarcoma, or you can say the sarcoma we will get only they are a rare tumor. And
sir, I think you muted your audio by mistake. Can you unmute yourself?
It's on actually. There will be internet connection.
Okay.
Hello.
Please go ahead. We can hear you, sir. Please finish your point.
Can you hear me?
Yes.
Can you hear me? As
Yes.
Dr. Samir already explained that, sarcoma tumor are very rare tumors. If we get the 100 cancers, then there will be chance of one among them will be the chance that it may be because of it is sarcoma. So the prevalence and the incidence of the sarcoma is rare. And in India, we don't have clear-cut directory as of now to say that this percentage of sarcoma is there in our country. But yes, they are rare tumors, and we at All India Institute of Medical Sciences we are getting so many referrals for this, and this is actually a tumor which need to take concentration on that.
So there are many referral cases when it comes to AIIMS, of course, most elite institute in the country. The numbers may be low, but awareness needed. And Dr. Adarsh, since we're speaking of awareness, a lot of it boils down to diagnosis. Early diagnosis always helps in cure. Help us understand the significance of early diagnosis when we speak of sarcoma treatment as well, sir.
So regarding sarcoma, mostly the tumors are a little bit rapidly growing tumor. But sometimes this tumor can be initially very slow growing, and when they undergo malignant transformation, there can be a rapid growth. So most important awareness, what patient should be aware of, is to look for any kind of lump or any what we call in Hindi as guilty or gaat. That should be clearly identified. And if it is, once they notice it, they should go to immediately take consultation of a physician to go ahead with the diagnosis. So regarding the diagnosis of this tumor, what kind of investigations are usually required are radiology, histopathology, and for spread other molecular science also. So when it comes to exact diagnosis, you require to categorize sarcoma into various subtypes. As Dr. Samir has already said, that the tumor is constituting only 1%. However, it has around 100 subtypes. So you can imagine that these tumors are so heterogeneous, and some of these tumors are so rare that a pathologist will see this tumor only once in a lifetime. So these are quite rare. So if you don't see a particular thing, you may not be able to diagnose that. So people who are more experienced with this tumor can diagnose these tumors more accurately in comparison to the pathologists who are not very much having exposure of this kind of tumor. And I think my both medical oncology colleague will agree to my sentence. So for this, biopsy is required for histopathological diagnosis. A biopsy can be a needle biopsy, it can be excision biopsy, it can be an incision biopsy. So depending upon the indication and the clinical judgment, the biopsy is taken. The most common biopsy which is taken is a needle biopsy or gun biopsy, which is routinely done and which is subjected to histopathology and light microscopic evaluation, further immunohistochemistry, then molecular subtyping for accurately diagnosing these sarcomas. So it requires a long workup for accurate diagnosis. And despite so much of effort, there are a set number of cases which cannot be accurately diagnosed on the basis of biopsy itself, or that is a gun biopsy itself.
Right. So Dr. Mandhania, would you like to come in here? Would you agree with the last panelist and expert's thought? Because many experts we've spoken to earlier as well had said that it's a little difficult to detect and diagnose sarcoma, and which is what makes it all the more complicated.
Yeah, I would like to put one point here because I am practicing at Nagpur, and the scenario at the institution and at the peripheral levels are very different. And the most important hitch and most important problem which we face in practice is patients are very reluctant for biopsy. They have a feeling if you touch the cancer by biopsy, it is going to spread. It is very, very, very strong notion in the society as well as in the layperson and some doctors also. So we are very, very problematic in terms of getting a tissue here because tissue is always the issue. And if we get a correct tissue, then the diagnosis become very, very important. And sometimes when we get the true cut biopsy also, the samples become inadequate or it is a necrotic tissue. And when we tell the patient to get a rebiopsy done, generally they did default. So the most important step in diagnosis of sarcoma is to get a very good chunk of tissue. And the second step comes is the correct histopathology. And thirdly is the advanced molecular testing and immunohistochemistry, which are available in all centers right now, or we can be getting available through the referral services. So the important thing here is, first important is correct diagnosis, and second is correct staging also, because if these two things are missed, then your treatment part is always a failure.
So, of course, the stigma around biopsy needs to be, of course, done away.
Yes,
Dr. Rastogi, if you could come in here, what causes, this type of a rare cancer? Is it in any way preventable? Is it genetic? Because there are a lot of questions which people have around the origin, really, to begin with sarcoma.
Yeah, so again, it's a very good question, but only 5 to 10% of sarcomas are inherited, genetic, or have a cause behind them. So there are some rare syndromes like Life-Romani syndrome, which is a genetic syndrome in which the likelihood of getting sarcoma is almost 20-30% more in boys than girls over the lifetime. Similarly, people who have some mutations like neurofibromatosis have high chances of a sarcoma called MPNST. Similarly, people who have retinoblastoma mutation, they might have high chances of osteosarcoma, but on an average, they constitute only 5 to 10%. Majority of them, there is no cause, and majority of them, they are not genetic. So this thing, they are not related to diet, they are not related to genetics, they are just due to some random cells which are proliferating. So majorly it's not because of diet or genetic.
So, all right, Dr. Shamim, if you could come in here, sir, once someone is diagnosed with sarcoma, what next? What's the immediate next step which follows? And how long does the treatment take?
Yes. After diagnosis, the most important, as other panelist has emphasizes on the role of biopsy, and then the imaging is done to classify and stage the tumor, like whether that tumor is localized to that particular part of the body or it has gone beyond that area. So that need to be find out, that we need to find first. That it is very important because the treatment depend upon that. If the tumor is very well localized to that particular area, then the surgery will be done. The surgery is the most important step in the treatment of the sarcoma. So after and if the tumor has gone beyond the boundaries of the lesion, or we can say it has gone beyond that site, then the treatment option changes. Like then the role of chemotherapy can, and then in some tumor, like Dr. Samir earlier mentioned, that some sarcomas are radiosensitive, some sarcoma are chemosensitive, and in some sarcoma, surgery is required. So it all depends upon the stage and the type of the tumor, and particularly where it has gone, the spread of the tumor. So these three modalities are combinedly used for the treatment of the sarcoma.
Right. And, we are reaching the end of our discussion. Dr. Adarsh, a big concern, and since, you're from AIMS as well, a big concern for the people is the cost of the treatment. Not everyone can afford it. AIMS also has limited resources. What does the treatment cost? How long does the treatment last? And then finally, the recovery phase.
I think this question can be very well answered by a medical oncologist. So I would request Dr. Sushil or Dr. Samir to please answer this question because they are expert in this field.
Okay, I'll take that question to them. Dr. Mandhania, why don't you answer that question? I'm going to go to Dr. Adarsh as we conclude.
The cost depends upon where you are. Okay, so if you are in AIMS, then cost is zero. But when you are in a periphery and a private hospital, then the cost is always there. But there are always, if there are a problem, there are always solutions to it. So if you talk about, I don't think I had been taught in AIMS, and my boss was Dr. Bakshi. He used to always say, cost is never an issue. Only thing is the determination of the patient to take the treatment. So the thing here is what we are planning and how motivated the patient is. Cost we can arrange. Cost is not an issue, but definitely yes, the cost is always a problem because surgery itself cost per patient. Then radiotherapy is there in the treatment plan. Sometimes it is chemotherapy. Then patient is coming from a different place. He has to stay back to the Nagpur or maybe in that area where we don't have any foothold. So that cost of staying there, the working hours lost by the relatives who are accompanying the patient itself adds to the cost. So we can decrease the cost. First important thing is there are a lot of government programs that is PM Relief Fund. It approximately 2 to 3 lakh rupees are being given to the patient for the treatment. Ayushman Yojanas are there. Every state has got its own program in the form of supporting the patient in terms of treatment plan. So yes, definitely cost is always a problem in cancer treatment, but there are a lot of solutions to this also.
Okay, and so there are a lot of ways around it. They may be meandering, but they are available. Dr. Rastogi, point taken. So Dr. Rastogi, as we conclude, I have one more question to you. May sound very basic to you. Is sarcoma fatal? Because a lot of people who watch any telecast, whichever I have moderated on cancer, most of the queries which we get is how long am I going to live? What is really the fatality of the cancer? Is there any cure to it? Or is all of this radiology, oncology, it's just an exercise in futility, sir?
Yeah. So it's a very daunting task to treat sarcomas as compared to other cancers because it involves surgery, medical, and radiation therapy. But if the stage is localized, if the treatment is up to the mark, on time, appropriate, adequate, then the outcomes are very good. And I'm sure there are lots of publications, even in advanced sarcomas, even metastatic sarcomas, that people can live beyond years. Till now, we were lumping the cancers in a single lump. But now it's a day and age of splitting. I mean, every cancer is different. Just the term cancer encompasses lots of entities. So sarcoma, if we separate sarcoma and the type of sarcoma, there are lots of drugs that have been approved in last decade. There are lots of therapies that are coming recently. So I think they might be fatal if it is advanced, if they have exhausted all the therapies. But currently, the scenario
if diagnosed early, it is treatable. And so, since you're one of the specialists of sarcoma in our country, is there any point which you'd like to add? Because we have about a minute or two to conclude the discussion, sir.
I just like to add that this sarcoma is a difficult treatment. They should be referred to the people who are treating them on daily basis. And right now, we have quite a bit of hope in this rare tumor. And every other day, there are some advances that are happening. So they should not give up. They should just keep on searching. And any lump and bump, even in initial stage, they should seek specialist or medical oncologist or surgical oncologist.
Point taken, Dr. Adarsh. I'm going to give the last word to you since you passed on your question to Dr. Mandhania. Early diagnosis seems to be key when it comes to any sort of cancer. If diagnosed early, it can save your life. Any message you'd like to give the people as we close the show, sir?
Yeah, the message for the general people or the public is that any lump which they are diagnosing, whether it is sarcoma or any kind of lump, it should be immediately taken to the physician for appropriate diagnosis and further management. Because what we observe in All India Institute is that most of the people or most of the patients who are coming in a later stage. They are in a very advanced stage. They sit over the illness for very long time. They don't see the doctor in an early stage. So that should be avoided. Any kind of cancer, if detected early, will definitely have a better prognosis than the cancers which are detected late. Other important thing is that there are centers in the country and there are specialists in the country who are dedicated for cancer. So those should be consulted instead of going for a local practitioner if they are not able to get proper therapy or they are not getting relief of that particular or that swelling.
Point taken. So go to a specialist. If you see any lump, go get it checked at the earliest. Of course, we have tried to create some awareness around rare disease like sarcoma. It's been a very riveting discussion, and I hope it has been as informative for the viewers as it has been for me. For now, I'd like to end it at this. Thank all the experts for joining us and talking about sarcoma on NewsX. Thank you so much.
एक भी फिंगरप्रिंट नहीं। कोई यहाँ कुछ छुएगा नहीं।
यहाँ से घुसा और दाईं, कुछ भी नहीं है।
लाइट ऑफ कर।
एंटी फिंगरप्रिंट लैमिनेट्स बाय ग्रीन लैम्प, हर गुस्ताखी साफ। जीनियस।
Hello and welcome. You're watching Medically Speaking. I am Meenakshi Upreti. Joining me is Dr. Ravi Shekhar Shah. He's the Additional Director of Pulmonology at Fortis, Faridabad. Thank you, sir, for joining us on NewsX. I'm sure you know that as of now, there's a lot of curiosity, a lot of questions around the new variant of COVID, which the World Health Organization has flagged. They say they're looking into it. Give us a little more about what we know far as this new variant is concerned. Do we need to be worried right away? Because I'm sure you know that the attitude of the people has also become rather lackadaisical towards COVID.
So the new variant that has recently been detected is, along with India, it has been found in around 11 more countries, and it is said to be highly contagious. You know, the fatality, the mortality rate, the risk potential is not yet known, but what we can see at this moment is it is strictly contagious variant, and it has the potential to affect whole family in one single day. So we need to be very careful because we know that this is a mutated variant, and mutated variant can turn into fatal anytime.
Right. It is a mutated variant, sir, and there is not much known about it. But talking really about the various variants of Omicron, what are the variants which are as of now present and prevalent in India? And what do we need to know about them? Because the general thinking, and I speak from a layman's point of view, amidst the people seems to be that Omicron, not that dangerous, nothing like the Delta variant. So we can, of course, go back to our daily lives without much caution.
No, so we have already seen the dangers of taking it lightly in second wave. This Omicron variant, basically, it has also the potential to mutate. It is mutated into various subtypes. The subtype that is present in United States of America and few other countries, BA.4 and 0.5, but the subtype that has now started gaining very importance in India is BA.2.75, which is very, very contagious. Now, the point is that any variant like Omicron variant, if it mutates into a dangerous variant and if it is contagious also, that can cripple whole country. So fortunately, the data that we have so far is that it is contagious, but not that fatal. But then, of course, for the last 2-3 days, I've started noticing increase in mortality rate in India. I've also started a slight increase in mortality rate in few other European countries where the BA.2.75 variant is predominant.
Right. So the fatalities, there is a slight increase. Of course, there are a lot of modifications of the virus as well. It also adapts with time. Where does science stand? Where does the medical fraternity stand as far as the cure of COVID is concerned? That panacea still awaits us, sir, isn't it?
One thing the scientist and medical fraternity is very sure about is that there's one thing which can give you almost sure-shot protection against deadly complication is the vaccination. The problem with India is that majority of people are still not booster vaccinated. People think that booster is not important, but the science has shown us that a few of the Western countries have shown us that booster dose is very important. And if we do not take booster dose, immunity has the potential of getting weaned easily. Just yesterday or 2-3 days back, our policy makers have reduced the timing of booster dosing also from 9 months to 6 months. So I think that is the one thing which can easily protect us from getting into fatal complications.
Right, and that really is a way to protect ourselves from fatal, complications. You since speak of the booster doses; they're available from quite some time, but the government says that the people are not going ahead and taking it as proactively as they were the first two vaccine doses. The government has also reduced the timeline from 9 to 6 months. First, what do you think of the move? And second, what would you like to tell those watching the broadcast?
The first thing is that we must not be very casual. Like I can see if you go to the malls or any other places, you can see people are, they kind of gather in crowds and they do not wear masks. They have completely stopped following COVID protocol. Now, since the new variant is on rise, we must follow the COVID appropriate behavior. We must follow all the protocols that are in place. If it is mandatory that we cannot avoid going out, then only we should go out. Otherwise, we should totally avoid going to the picture halls and other crowded places like the marriage function. Other function also should be there should be limited number of guests. We should not invite everyone. There should not be too much crowding at any place. That is one thing we must follow. Plus, we must encourage our RWA to promote for booster dose vaccination.
Right. Promotion of booster dose vaccination, absolutely vital. Sir, as a pulmonologist yourself, what is the impact of the new variant which you are seeing? Of course, the Delta variant was a very difficult time for all of us, but the hospital admissions, where do they stand as of now? What's your personal experience like this time around?
I have not seen any admission because of any respiratory complication, although it has happened that patient had come for some other problem, like the patient presented with for some other complication and routine screening, he was found to be COVID positive. That is different thing. But otherwise, so far in my region, I have not seen any patient who had COVID and presented with respiratory failure or any other major respiratory complication. I remember there was one patient who had history of bypass surgery, and then he developed COVID. He developed pneumonia also, but then we managed the patient at home only. He had developed mild respiratory failure as well, but then patient was easily managed at home. So basically, if the patient develops any complication also from Omicron variant, it is easily be manageable. But then again, the newer variant BA.2.0, we are not very sure about how fatal it can be, how dangerous it can be.
Right, and that's something which is still in the unknown territory, and that's why perhaps we need to be more cautious. Take us through really, how this new variant is different from the other variants which we have seen, and the steady rise in the number of COVID cases which we are seeing in our country, because that's something about which awareness also is a must.
So the new variant is, if I come into contagiousness, the new variant is strongly contagious. As far as symptoms are concerned, the major symptom of new variant is severe headache, body ache, and fever. May not be very high, but fever is there. Nasal stuffiness persists for very long. In majority of patients, I've seen that the symptom persists for around 7 to 10 days, but mostly they become non-contagious at 11th day. But otherwise, generally, it is strongly contagious and symptoms are slightly different from the conventional Omicron variant, because we had seen Omicron variant patients had a lot of GI symptoms. They had a lot of gastritis and loose motion and nausea. These variant presently majorly with headache and fever.
Right. So headache and fever are perhaps the most significant and most telling manifestations of the latest variant, sir. But when we talk about, the latest Omicron variant, how effective is the vaccination and the booster dose against the same? Because as I said earlier, the numbers dwindling, people seem rather skeptical. Either it could be skepticism or it could be just a laid back attitude when it does come to taking that third booster dose, which the government has now made available.
See, one we must be very careful about is that booster does not, or any vaccine does not prevent us from getting any infections. So, rising number to do with vaccination. Only thing is that if everyone is vaccinated, the vaccine can prevent us from going into severe complication. That is probably one of the reasons that we have not seen any major complication despite getting so many infections. That is the reason I always encourage people to get vaccinated, normal as well as booster dose vaccination.
Right. The time has come to get ourselves vaccinated, sir, but there are a few sort of misgivings as far as the booster dose is concerned, and let's dispel them one by one quickly. First of all, being those who are affected with COVID. Once someone does recover from the Omicron variant, which of course many of us have unfortunately managed to catch it at least once, what should be the gap between taking the next booster dose? Because there's a slight confusion about the same.
So various countries have come up with various guidelines about the gap, but ideally speaking, 3 to 6 months of gap is sufficient. I mean, once you have got 3 to 6 months, you should get your that holds true with novel vaccine also, because once we have taken second dose of vaccine, the gap between second dose and booster should be 6 months. Similarly, if you get a natural infection, you develop some antibody, then the gap between next dose should be 3 to 6 months only.
Right. So 3 to 6 months should be the gap between the recovery from COVID. One more question, sir. Since, of course, you are a pulmonology expert, you say that the impact the Omicron variant is having on the lungs is rather low. But what about the comorbid? Because the example which you gave of the patient who did land up in the hospital, who had a comorbid situation, which is what got you all alarmed, tell us a little more about comorbidity, respiratory diseases, and of course, the latest variant.
So even with comorbid people who are completely vaccinated, I have not seen any major complication. I had seen many people who were obese, who had uncontrolled diabetes, but still their symptoms are self-resolving. There were patients who had severe asthma, who had severe respiratory problem. Again, they developed COVID, but their symptoms are very, very mild. So, but one thing I had seen that almost every one of them was vaccinated. The one patient which I'm talking about who developed respiratory failure also was vaccinated. But then overall, if you see out of 100 patients, rarely one or less than one gets to complication. Even if the person has kind of comorbidity, although he's at high risk of getting into complication, but I have not seen any major complication in this Omicron variant.
All right, that seems to be silver lining there, but certainly as we sign off, we'd like to tell our viewers that you shouldn't go by the silver lining. Nobody knows what really lies on the other side. There are many who are comorbid, and there is a possibility of you, even if it's a 1 in 1,000, of developing, of course, a more severe disease, of getting more severely affected with the Omicron variant, with the new variant lurking. The World Health Organization ringing the alarm bells. Perhaps it's time to mask up, to try and avoid crowded places as much as you can, of course, as the learned doctor does advise us on the panel here on NewsX. For now, sir, thank you for joining us and speaking to us.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.